A couple things, and I'll open for questions. My usually infallible communications office inadvertently put out a release that's an error. We were overly optimistic. That was the one we were hoping to put out about securing the waiver. We have not secured the waiver, so I'd like to retract that, and we'll issue a revised corrected release very soon hereafter. And you know, we're still waiting. We've been waiting for weeks to get this formal approval from CMS and from the Department of Health and Human Services, and we can document, I don't know if we could provide the chronology of all the communications we've had in writing with CMS, as well as countless telephone conversations, meetings, to get this all lined up properly. We're told all along it was lined up properly, that there were no problems with it. I was told verbally by the Secretary of Health and Human Services and also by the CMS administrator in July that we would have this approval formally by the end of August. And now we're really at the deadline, the very deadline where MinnesotaCare and the Department of Commerce have to decide on which rates to post, the ones that are with the reinsurance program or without, and it's about a 20% difference in rates. So this is jeopardizing the credibility and the integrity of the entire MinnesotaCare program, and it's just, I've never experienced anything like it in my 6 years dealing with a Republican administration before, and my 6.5 years now dealing mostly with a Democratic administration. I've never experienced anything like this. I can't even get Secretary of Health and Human Services on the telephone. I can't even get a phone number to call him to raise the issue. I greatly appreciate what the Minnesota congressional delegation has done, both the Republicans and the Democrats. Senator Klobuchar's called to Secretary Price. Senator Franken got the chairman of the Senate committee, Senator Mar Alexander, to call Mrs. Verma on behalf of Minnesota. That's exceptional to get a senator from another state to call on behalf of another state. So I just, they've done everything they can. And we just have to get this official approval right now, or it's going to cause enormous disruption to. Where's Allison? Got my back. Okay.
I got your back.
All right. Well, you can elaborate.
Absolutely.
Sorry about that. I kept looking. I always look to my left, Right? So we got to respond to question on that. The basic health plan funding is deeply disturbing. We're working closely with CMS. We followed their instructions exactly how to word the reinsurance legislation so that it would not cause a reduction in our funding for the basic health plan. And then we find out, literally last week, that it's going to be $369 million reduction, which is still on paper. And of course, all this is up in the air now because, if they repeal the ACA, then, all bets are off of everything. So, what Congress is, and the administration have caused to the security of people, Minnesotans who depend on this health insurance. 20% insurance rate difference for a farmer trying to afford care under difficult economic circumstances, for a single mother who's working from home and is trying to afford these rates. These are real people's lives that they are threatening by what they're doing and not doing. But that piece of it, the basic health plan funding which goes to MinnesotaCare, will not jeopardize, even if it's carried out, our ability to offer MinnesotaCare through calendar 2018. Fortunately, there's reserves that we've built up in preparation for something like this, which will cover that. So I don't want anybody out there who depends upon MinnesotaCare to be concerned about their situation for the foreseeable future. But again, all bets are off if Congress does what they're considering doing to the basic health plan, to Medicaid, to really the healthcare system in Minnesota and across the country. So it'd be good to, but as I was saying, that doesn't need to be resolved today or tomorrow. This is the urgent situation is the 1332 waiver. And then finally, just to expect some questions about the mediation process, I bring your attention to a statement that I believe both my attorney and the attorney for the legislature put out this morning, and it concludes saying, at the mediator's request, the parties will not be communicating further prior to mediation being concluded. So I have nothing more to say about the mediation process, which, as you know, begins tomorrow. If it's not successful, I'll have a lot to say. But for the time being, I'm going to enter into it in good faith and follow the urging of the mediator. So on any other subject, I'm open to questions.
Any questions?
To be clear, on MinnesotaCare, nothing through 18 will be affected. And if you're pulling from the reserves, does that threaten the future somehow?
So MinnesotaCare has, because we're a basic health plan under the ACA, we have the opportunity to take the money that the federal government contributes in excess of what the cost is to operate the program and put that in a reserve, because our funding federally is tied to tax credits. So when the rates on the individual market go down, our federal share of MinnesotaCare goes, our federal share for MinnesotaCare goes down. When the rates on the individual market go up, our federal share for what we receive from MinnesotaCare goes up. And so because the rates have gone up last year, we have been able to take some of the funding that we didn't use that year as a state and put it into the reserve fund. And federal law requires that that only be spent for MinnesotaCare. So that is projected to be for this year, $55 million, plus we would receive tax credits for next year if the ACA isn't repealed, in addition to the $300 and some million that the waiver would take away. And that funding, coupled with the funding that we still have in the Healthcare Access Fund through the end of 2018, we think would be sufficient to fund MinnesotaCare, but it would bring down over time the amount of money in the Healthcare Access Fund before 2021, and it would completely deplete all the reserves we have to run our MinnesotaCare program in our basic health plan trust fund.
The human impact that we're looking at here?
Sure, well, I really think the challenge with this is we asked for this waiver from the federal government so that we could take the funding that people would have gotten in tax credits without reinsurance and redirect that funding on the individual market to our reinsurance program. And so that was money the federal government was going to pay already in higher tax credits because of higher premiums on the individual market. And essentially what they're saying is you can only do what you want to do and repurpose the money we were already going to pay for your reinsurance program if you cut funding for the program that serves almost 100,000 of Minnesota's working poor. And just for some context, that's people for a family of four. That's at the max, people making an annual income of $49,500 a year. So we're talking about health care for people all across Minnesota, particularly in greater Minnesota, being the long-term financing and stability of that program being put in jeopardy as a result of the federal government cutting our sustainability options for that program going forward.
Can you discuss how Minnesota found out about this? Because my understanding is back in April, you all were talking about this exact issue with the federal government. When did you find out that the state would be penalized?
Let me just say that, and Commissioner can elaborate, as Lauren Gilchrist, who's really done a fabulous job as the point person on this from our office, but this came up last spring. Again, we were designing the reinsurance bill that passed with this and other considerations in mind because CMS insisted, absolutely required that we make the plan, the reinsurance plan, dependent upon CMS approval through the 1332 waiver. we followed exactly the instructions, and again, we can document this, that the CMS staff provided. They gave us two options for how to structure the program so it would not affect the basic health plan, and we followed that precisely. And, and we're not ever getting any indication thereafter until literally last week. Is that the first time we found out that, oh, by the way, it's going to cost you $369 million in federal funding for the basic health plan. I point out that there are only two states that have this basic health plan, New York and Minnesota, and I can see why it's probably not dearly loved by the administration, but it is federal law. And I go back again, President Trump and Secretary Price, again and again, publicly and in meetings with, I've had, and with the President, with the Secretary, and with the President's had with the National Government Association, encouraging states to apply for waivers, encouraging states to be innovative. We, Minnesota legislature passed a nationally recognized program for reinsurance. It's going to have reduced rates by 20% on the individual market. We've done what they urged us to do. We've done it exactly the way that they told us to. And now we're approaching the end of September, and we can't get official approval necessary to be able for Ms. O'Toole and her team to be able to implement the program when open enrollment starts, which is already upon us. So, and the deadline for them to process which set of rates they're going to put into the notification, which is, got to be, it has to have been done already. It's just unfathomable why we can't get this approval.
Clarify, are you saying that the president is penalizing Minnesota because you?
No, I'm not saying that. I'm just saying there's a fact that there are two states, New York and Minnesota, that received this particular funding, and so it's probably it's understandable why it's that part we're talking about, the basic health plan funding. It may not be their top priority, but that's a statement of fact. I'm not making any assertions or implying anything.
What reason have you been given for these cuts? Given the assurances that you've had back to April or earlier that there was a way to protect the MinnesotaCare funding.
Well, I don't want the way they're applying the formula, but I don't know the conversations we had as to how to circumvent
We don't have
that.
any detailed analysis in writing about how they're approaching it. They're just saying that they don't believe that it's allowed under the law to do the pass-through. That's as far as.
Which is contrary to what they told us.
Yeah.
And how we structured the program, following their recommendation last May, before we submitted the application.
From whom did you all hear this at HHS?
This is,
You want to hear? Yes, please.
there have been ongoing staff-level conversations with both staff at HHS and Treasury. So this was a conversation that was with HHS staff on Friday. Mm-hmm.
And so was the state's immediate reaction, whoa, wait?
Oh, yes. No, there were strong words exchanged, and I think at the staff level, people understood that this is a challenging situation that Minnesota has been put into.
And so is there any option to not go forward with reinsurance to save the Minnesota basic health plan? Is that?
Well, if, again, under state law, the reinsurance plan for calendar 2018, or for now going forward, is dependent upon getting this 1332 waiver. So if we don't have not received it officially, then Minister would have to proceed with the unreinsured rates, which would be 20% or more higher, and that would have just a devastating effect on the individual market, as well as on the decisions that people all over the state are going to be making. As I said, people are self-employed. Farmers, has been a huge benefit. The rebates and now the projected benefits from reinsurance have been a huge difference for people who are struggling to afford the rates even as they would be under that program. And it's just really it's really inhumane the effect it's going to have on people, and we're doing our utmost now, and the reason we have kept this, not quiet, but we've done everything we can to resolve this, working with the administration officials, because there's so much at stake here, and I don't want to scare people. We don't want to scare people about, what might happen in the future, but we can't avoid that reality any longer. It's just upon us, and we'll have to see. We're going to keep pressing to get this 1332 waiver officially approved, then the program can go forward for the 2018 open enrollment. I don't know if you want to elaborate, but.
Thanks, Governor. As the Governor said, this delay could potentially have a real impact on Minnesotans. I hear every day, I talk to consumers every day about how nervous they are about their coverage, and they can't sustain increased premiums again this year. They need this relief, and that is why I think everyone's faces look like they do today. What we need to do, we need this approval now. So Minnesotans on the individual market, that 5% of Minnesotans who are don't get their coverage through their employer or a public program, that's the slice we're talking about. They need to have clarity, and they need it soon. So we can run eligibility so they know what their tax credits are, and they know what they're shopping for, and they know what it's going to cost. And so we need to get going now on that. That's why this is so important.
You're past the deadline already for setting rates because of this. Does this mean that open enrollment would be delayed?
No, I think we'll be faced with a hard choice. We, pursuant to state law, rates have to be published a month ahead of open enrollment. That announcement, I understand from the Department of Commerce, is going to be October 2nd.
Representative Davids told me that if the waiver doesn't come in time, that there will be no individual market in 2018. I know you don't want to scare people, but is the situation as dire as he was predicting then?
Well, I think it's going to impact people's ability to afford coverage and what they'll choose.
He said that the insurers themselves won't be able to do anything, whatever he meant by that, but he was saying that
They submitted two sets of rates. None of them have indicated that they're going to not participate, those who participated this year in 2018, but they submitted two sets of projected rates to the Department of Commerce, and the ones without the reinsurance program are, again, on average, 20% higher than the ones with that program. So, MNsure will go ahead, the open market will go ahead, but with rates that will be unaffordable for a lot of people, and that's why this is just so really cruel. And and it comes at a time when MNsure is really doing extremely well. Very, very proud of Commissioner O'Toole. You've done a phenomenal job. You and your team is running smoothly. And all the what are the helpers called?
Assisters.
Navigators. There we go. Navigators are on board, and really, everyone's primed to make this the best open enrollment period that we've had in Minnesota, and we just got to get this waiver approved.
Just on behalf, just for the sake of the copy editors and TV producers around the city that would call these MNsure rates. These are not MNsure rates, correct?
That's right, John. Thank you so much for that clarification. These are rates for the individual market. And that is, again, the 5% of Minnesotans that don't get their coverage through their employer or a public program. These are the rates for that entire 5%. We enroll a portion of that 5%. We are, and there are advantages to coming to MNsure to shop and choose your coverage for those folks. It's not only a place where you can do an apples-to-apples comparison across plans to have a better picture of what you're buying, but we are the only place where Minnesotans can save money on their coverage, and that's through federal tax credits. And those tax credits were so important last year. I expect that they will be just as important this year. About 65% of our enrollees are receiving those tax credits. They're averaging more than $7,000 a year, and that is real money for Minnesotans. They need that relief. I think Minnesotans are poised to save over $300 million through those tax credits this year. But you're right, John, and I appreciate the clarification. We insure a portion of the individual market.
And we don't set the rates.
And we don't set the rates. That's right.
The governor said this would be unaffordable. I don't know if you were which one of you wants to answer this? Given that, how many people do we expect not to get insurance because they can't afford it?
Well, I can't speculate on that, Don, but what I do know is that when I talk to consumers, and I've talked to them all summer, they are worried about having coverage, and they're worrying about being able to afford coverage. And so this is only going to exacerbate that.
That's some not to, a significant number not to take insurance?
I think this is going to be a really hard choice for Minnesota families.
Following up on the tax credits, what will happen if the Cassidy-Graham proposal passes?
A lot. I think I'm not particularly clear on the specifics of the tax credits. I've seen other proposals that have just, really decreased and kind of finagled the calculation that goes into those tax credits right now. The proposals that I've seen to date really impact greater Minnesota more than the metro area. And so we talk about that, the farming community in greater Minnesota, the self-employed folks in greater Minnesota, they're going to be hit the hardest.
Question about that. On the fact sheet we have here, it says that financial assistance will be eliminated for more than 80,000 people. Would you comment on that and on the Medicaid funding?
So the repeal of the ACA that's being contemplated now by the Senate is similar as it applies to our public health care programs, both MinnesotaCare and Medicaid, as the bill that passed the House and the bill that failed earlier this year in the Senate, in that it completely defunds the federal share of MinnesotaCare. So it eliminates all federal funding for MinnesotaCare, so we wouldn't be able to access the 95% of the tax credits that we do now for purposes of the federal funding for MinnesotaCare. And then it caps Medicaid spending as well, and is projected by us to cost over the first 10 years a cumulative approximately $31 billion. In addition to that, the state, regardless of what happens in Congress, there are these risks about what the administration administratively can do. And one of the things that we're really concerned about is their continued funding of the cost-sharing reductions. In Minnesota, over the next 2 years, MinnesotaCare is projected to be the beneficiary of $235 million worth of CSRs. And right now, the administration is only funding CSRs on a month-to-month basis and making that decision every month for the health insurance companies and for our basic health plans. So those are a couple other pieces that are potentially impacting the bigger picture of financing our public health care programs.
Month to month because of the specter repeal and replace? Or why are they doing month to month?
My understanding is Secretary Price is just making the decision on a monthly basis whether or not to continue funding.
Any questions on other topics?
Well, on this, would this affect 2018, MinnesotaCare in 2018, the Cassidy-Graham, or would it be future years?
Absolutely. So you can look in isolation of all of the other funding challenges that are potentially happening at the federal level. But in aggregate, there are a lot of risks going forward for federal funding for MinnesotaCare. I think the most immediate is this cost-sharing reduction issue, because we could learn a month in advance that we're going to stop receiving those payments, and then ultimately have to finance that loss, at least at first, through the reserve we have in our trust fund, but then going forward, that would be depleted.
Actually, look at that.
Well, and let me say, Secretary Price makes that decision or announcement, but President Trump himself is the one who said that he wants to eliminate that CSR funding, and that's why and pretty much most of Congress, well, I shouldn't say most, a lot of Congress, both Republicans and Democrats, have objected because of the effect it would have on rates in all of the states, which is why it's now being carried on a month-by-month basis, and it's, I'm told, conditional. It's part of the equation in terms of they're trying to repeal the ACA. And if they repeal the ACA, it depends on what the language is, what the effective dates for these various, and whether the funding would continue up until, is it 2021? Is that when they're right now in the bill to take effect? But would the funding continue? And what our insurance company's going to do with the uncertainty factor, and I mean, it's just, they're just, you know, if the repeal of ACA passes, it's going to just be a nightmare. And the uncertainty for states and for people in Minnesota and across the country are going to be just really destructive.
Question, have we given any thought to rejecting the waiver and using that money and turning it into a rebate program like what we did last year?
Well, that's a good question, and Senator Lori is championing that. It would require a special session. I mean, it's in statute, we'd have to do that if we're going to have a special session for other reasons in the next few weeks, so we can assess the situation at that point in time. That would be an option, but it would affect, you know, it would mean people would get higher rates, and then they'd get a rebate for those who sign up for what, you know, some part of that. But it wouldn't be this across the board 20% lower rates. So it would still have a very, if they, you know, don't approve the reinsurance, it's going to have a very negative effect on the broad swath of Minnesotans who are buying, you know, before the beginning of the year.
Given that you've had the assurance that BHP funding wouldn't be touched for months, do you believe that these cuts with the waiver are politically motivated?
I'm not going to say that.
Related to that, does this make you think differently about not signing the reinsurance bill? And secondarily, as you go into mediation, are you going to bring this up as a possible topic to discuss in mediation as if you go into special?
Well, I'm not going to comment on mediation, so I'm not going to comment on that. I didn't sign the bill because it didn't have the public option that I wanted to have so that everybody throughout Minnesota would be assured of having a lowest possible cost option for insurance to 18. And that was the reason I did not sign the bill, but I was aware throughout the Republicans were, you know, Senator Gazelka and Senator Benson and others were, you know, very forthright throughout. They were very receptive to our guidance on drafting the bill, and we in turn were following exactly what CMS required. So I mean, it was a very cooperative effort. I don't have any criticism at all of the process or the result, except for the lack of the public option.
Are there any parameters established in the rules of mediation that would prevent you from talking about that?
I'm not going to comment on mediation. I just, you know, I just told you what both lawyers filed and the mediator has urged. And so, you know, parties will not be commenting further prior to mediation being concluded.
Anything on other topics besides mediation?
On part of the Moorhead diversion, you said you want to have a conference call, and you also want to have meetings with local officials and residents. What's the timeline? Are you talking about, do you want to meet with the Moorhead and other officials first, then do a conference call? Do you want a conference call first?
Well, Governor Burkham requested the conference call and a chance to talk with our DNR officials in more detail about what exactly their reasons for denying the permit for the project as it's presently proposed. So that's what we're setting that up by. We're going to try to do it in the middle of mediation on Friday if we're still continuing at that point. I'll step out for that purpose because we want to do that as immediately as possible. I don't know if, you know, we have to juggle people's schedules, but otherwise it'll be very beginning of next week. So that's separate from, you know, I said I'm not going to get involved in negotiating and under, you know, again, I'm not familiar, I'd have to defer to Commissioner Landwehr and his staff under laws and rules that affect the permitting process. I mean, we don't have the latitude just to go in some room somewhere and negotiate something different. It has to, you know, so I'm going to I made it clear I'm not going to be able to engage in that, and DNR will have a better clarity about what's possible and what's not, but I'm not going to, I told the governor that my intention was, if he and I are going to meet together, which is what I proposed in the near future, that I'd want to meet first with those three Minnesota groups, the city officials, the people south of Fargo-Moorhead, the people north, and get their up-to-date input in the whole, so they can be part of the process. But big part of our objection to this, and the reason it went to federal court, was because the The diversion authority was set up with predominantly North Dakota members. And I think there was one Minnesotan, and then they added one more, so there, I believe it's 7-2. I'm not sure the exact number, but we can get that for North Dakota. So, you know, whether we continue with that group or not is something we haven't resolved, but it's going to have to be a better balance of Minnesotans and North Dakotans so we can, so the Minnesotans have an equal say in this.
You do plan to have a face-to-face meeting with North Dakota government?
I offered to do that, and he was, you know, he wanted to have this conversation with the conference call first, but I'm going to continue to urge. He was, you know, he was not receptive to it, but, you know, I'm going to continue to urge that, you know, as soon as we can put it together on our schedules, you know, within the next 2 weeks, hopefully, that I said I want to meet with the Minnesota groups, and then I'd go to Fargo to meet with him.
Will meetings with the various groups be public, or they like mediation and top secret?
We won't have a mediator. I can't say at this point. I have no problems with their being public. Let me say that. These are the meetings with the groups. I'd have to talk with Governor of North Dakota about the other, and the conference call is for Friday is not public, but we can report to you about it after it occurs.
Healthcare for a moment. Did you say that you can't even get a phone number for Secretary Price?
Yesterday. Isn't that Katie should right?
Is that unusual for a governor not to be able to get a cabinet secretary?
Unprecedented in my experience, as I said, as a senator with 6 years of Republican president and 6 years with a Democratic president as governor.
So is it as a senator and as a governor?
I've never not been able to get a hold of or get a call back from a cabinet official.
And do you have a feeling that's on purpose, or is it just the?
I think
They do not want to talk to you?
call off the record. If you read the headlines, you'll see that the secretary had other matters on his mind, which might explain it. And of course, they're all in the throes of the Affordable Care Act. He's one of the people on the point of trying to negotiate with the members of the Senate. So I mean, I respect that he has a lot on his plate right now.
Everyone good?
And he did take a call from Senator Klobuchar. She did speak with him, and he did take a call from Administrator Verma took a call from Senator Alexander. So that, they've been responsive in that respect.
Okay.
I learned long ago that senators have a lot more influence in Washington than governors. And that's true across all administrations. Okay? Thanks very much.
I want to personally apologize to everyone for the error in the news release. I have a corrected version.